Good morning, I'm Dr. Charafeddine. I'm with Dr. Labib, and we're going to talk about how at Eden we think outside the box when it comes to facial rejuvenation. We're going to tell you how we prepare our patients for their procedure and the importance of really looking into the cell to prepare the patient for the upcoming procedure. In the past, I used to do the testing only for patients who had some issues. Now, this approach is becoming mandatory. I do it for all my patients. It's mandatory in my practice. Everybody gets tested before getting the Eve lift or getting a facial rejuvenation procedure. And it's helping a lot of patients. It's helping a lot of my patients.
Yeah, of course, the traditional testing that are done pre-op to clear the patient, make sure all the body functions are normal, are extremely important. These are a must, of course. But today we have to look deeper. We have to look at the genetic makeup of each person. Look at the function of our organs in a different way, not just the traditional test. Because these traditional tests show us the surface. They don't show exactly what's happening in the cell. And I think by combining the history, their lifestyle, those traditional tests plus the functional test, we'll have a better idea of how this person functions, and therefore we will be able to give them a better outcome overall. And the nice thing is not only in the short term, it's something that can be done in the long term, and I think those tests are improving on a daily basis, and we will have much better tests in the future where we'll be able to know very meticulous details about each person's cells. Maybe we're not there yet, but I think we're on the verge of having really a lot of information about each patient. And I think, with the invention of AI and all these, wearable devices and very specific genetic testing and eventually some imaging, all this will be placed into one algorithm, and we will really know every patient where they're at in their life. And this will help us prevent disease. And of course, when it comes to cosmetics, improve their looks and improve their health overall.
So at Eden, this is not a conveyor belt structure where patients come in, get their Eve lifts, and go home. This is actually the old way, or the traditional way of doing facial rejuvenation. Aging of the face is always a reflection of what's happening on the inside and the environment. So, for example, people who have a lot of sun exposure have a lot of burnt skin, and they tend to have a lot of loss of elasticity. Now, how is it also a reflection on the inside? It's the genetic makeup and the hormones. So when someone, and I look at this in my family and everyone around us, when a younger woman is pregnant with all the hormones really almost at a perfect or more than perfect level, you see her face is shining. You see the skin is absolutely amazing. And as aging happens, it's not only due to gravity that things start to fall down. It's also due to the hormonal changes, the genetic makeup of the patient. Now, for the external factors, the environment, toxins, pesticides, mold, mycotoxins, sun exposure, and all these things. So at Eden, we look at the patient as a whole. We look at you as an individual who has a genetic makeup and cellular level of hormones, and we look at the exposure, and we try to work on all of these together, and then do the procedure, which is really just one part of a bigger puzzle.
To add more to what Dr. C was saying is like the hormones. I know a lot of people are scared of hormones. They're worried that hormones can cause cancer. Of course, not every patient is a candidate for hormone replacements, and this is where we come in. We sit down, we talk, we make sure the patient is a good candidate for hormone replacement. It all depends on their history, if they were on hormone before. So hormones are important for collagen production, which will hold the skin together. We want to also make sure that these cells are functioning well. Every cell has an engine in it called mitochondria, and we want to make sure that the mitochondria are not lazy or not able to produce energy, because you need energy inside those cells to heal well. And so that's where the consultation will dig into their specific history, talk about hormones, kind of remove any myth about hormones that some patients have, and see if they're the right candidate for it. And the earlier we start the hormones, the better it's going to be the collagen production. And like Dr. C was saying, pregnant patients which have higher levels of estrogen and progesterone, they glow. And we want patients to come in to the procedure glowing and then continue that after the procedure. So vitamins are extremely important. Vitamin D is a must, and it's crucial for hormone production. We want to make sure their liver functions are also doing well, clearing their toxins, producing hormones. Stress levels. So one of the patients that we talked about, her stress hormones are extremely low. So she has exhausted a lot of her stress hormones over the years. So she does not mount a good response to stress. So she feels tired most of the day. So also this is not going to be helpful, because cortisol is like the maestro of the hormones. So if your cortisol is low, you're not going to be able to adjust your other hormones. So it's very important to have your cortisol in a nice fashion so that the rest of the hormones will function very nicely and homogeneously.